I want to welcome all of you to the first Paul Torrens Health Forum of the academic year. I'm glad you could all be with us. I'm Laura Erskine from the Department of Health Policy and Management in the School of Public Health. I want to first acknowledge the most important person associated with the Health Forum, Paul Torrens. And I hope you've had a chance to see all of the sponsors who make the Health Forum possible. The Health Forum has been in continuous action since 2011, so this is a tradition that we hope to continue for many years going forward. Are there any Health Forum Advisory Committee members in the room? Health Forum Advisory Committee members, thank you for all of your contributions. Okay, so tonight we're talking about precision medicine, and we have, I think, a great lineup of speakers to talk about some different aspects of what is really a cutting-edge technology and treatment area. I'm going to start by introducing our moderator, Patty Ganz. You have her full bio in your programs, but I just want to highlight a couple things. Patty has been a member of the faculty in the School of Medicine since 1978 and in the School of Public Health since 1992. In 1999, she was awarded an American Cancer Society Clinical Research Professorship for enhancing patient outcomes across the cancer control continuum, and she received the American Cancer Society Medal of Honor in 2010. Dr. Ganz was elected to the Institute of Medicine in 2007. She's a pioneer in the assessment of quality of life in cancer patients and has focused much of her clinical and research efforts in the areas of breast cancer and its prevention. Dr. Ganz.
So thank you for that very generous introduction. And you might wonder why I'm here talking about genomics. Well, as a cancer doctor, we've been doing genomics for a long time and aspects of precision medicine and precision health, but I think what you're going to hear about today is very exciting and will be very broad-reaching and will lead to a very stimulating discussion. But I've titled my little introduction here, Precision Medicine and Precision Health, a 21st Century Opportunity, because I think we are really on the threshold of many exciting things that we can do either in the area of medicine, which is delivering care to people who have an illness or a disease where they need a diagnostic test or something to understand their diagnosis, but certainly for precision health. And if we think about the health of the population, public health, population health, the hope is that we will be able to identify risk factors for particular health problems before they occur. So let's talk a bit about how we got here. The current trend is precision medicine, and in fact, the National Institutes of Health is sponsoring a very large million-person trial that is going to look at this. And these slides are taken from their website, where they say that precision medicine is an emerging approach to disease prevention and treatment that takes into account people's individual variations in their genes, that's in their own DNA, the environment, and in lifestyle or behavioral factors. And again, the Precision Medicine Initiative that, again, was rolled out a couple of years ago from the NIH, they hope will generate the evidence needed to, in fact, bring this into clinical practice, but we're not exactly there yet. And why now? Okay, I was just speaking to someone earlier about why is this happening now? Well, like a lot of things in technology, the cost of sequencing the genome or an individual person's DNA has come down tremendously. So we have very high-tech strategies to do this, and just like all our computer and other supplies, they've come down in price. We have very much better ways to analyze this big swath of information and lots of technology to help this go forward. And I think our first speaker will spend more time talking about that. The near-term goals of this initiative, which again is going to recruit 1 million people across the United States, is to develop studies or trials where we can identify people who might be at risk or have a condition that is genetically or genomically identified so that we give the right drug to the right person at the right time. We can potentially combine therapies and again figure out why treatments are not working because of these genomic or genetic abnormalities. And again, the longer-term goals are really to be able to look at the health of the population and hopefully prevent disease. And part of this model that they're doing in terms of going out into the population is really engaging the community of volunteers to say, you know, what would you like to know? What would you like to be involved in? You're going to give us a specimen, either of saliva or blood, and we're going to find out all about your DNA, but what do you want to have back? What are the things that are interesting to you? And again, things that we can look at in this treatment, again, could be anything from choosing a drug correctly by this, treating and prevention. We could collect information about people's lifestyle with mobile devices and other technology, and again, be able to understand the development of disease in a more rigorous way. This really closely dovetails with a number of trends in our society in terms of what's gone on. We had the HITECH Act in 2009, which in fact led to the widespread utilization of computers in the care of patients in the medical setting. But along with that, there was an interest in engaging patients in their own care using this kind of technology, getting patients' electronic reports back to them and so forth. The ACA and the Internal Revenue Service requires a community assessment to know what's going on in the community. And CMS, the Center for Medicare and Medicaid Services, that pays for health care insurance for a good portion of our population, really thinks that engagement with patients is really critical for them to have better outcomes in terms of their health care. In addition, there have been many other panels that have talked about why collecting this kind of data and having patient engagement in kind of personalizing what's going on is very important. PCORI, which is again something that came out of the ACA, it's an independent funded research group, has patient-powered networks where patient groups are coming together, driving the nature of research, but contributing specimens. And again, the idea is this issue of patient engagement, informed and educated patients who can participate in their care to do prevention as well as disease management. This is also part of something that the Institute of Medicine has been talking about for a long time, which is a rapid learning healthcare system. And now that we have the ability to collect electronic health record data from patients at the point of care, you know, when they're being seen, collecting blood specimens and potentially using it for other studies, this allows us to really understand what's going on in the real world. Because I can tell you as a cancer doctor who does clinical trials, the 3 or 4% of people who come into our cancer clinical trials are not representative of the universe of patients that we actually treat. They're younger, they're healthier, so that if we get a drug approved for any condition, whether it's heart disease, diabetes, or cancer, it's been tested in very healthy people, and then we don't know exactly what's going to happen when we give it to the population. So using electronic records, mining them, and understanding this can tell us about what may work better and how we can treat people more effectively. So again, this has all become possible really over the last 8 to 10 years because of the technological advances in electronic health records as well. So the Institute of Medicine defines quality of care as the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. And the attributes of quality of care are that it should be safe, effective, patient-centered, timely, efficient, and equitable. And I kind of highlighted three things that I want you to think about as we hear our discussion tonight. Is there efficacy or effectiveness with the tests and the things that we're going to be talking about? Is the use of these tests patient-centered? And is there equity? Will these tests, as they emerge, be available to everyone in the population at a price we can afford? So those are just kind of 3 points that I want you to think about. So some of the challenges to the delivery of precision medicine, as I see it, as a clinician primarily, is that medical care today is very fragmented. People often go to multiple specialists. They don't really know who's coordinating their care, who's the quarterback. Poor coordination of care. Patients may not really know who their doctor is, particularly if they have a complex illness. You know, if you're healthy and you're just going to your primary care physician, who that is. But once you go into the healthcare system with any kind of unusual problem, you have many doctors. And really the question I pose is, who will help me make decisions about treatment when my genome has been sequenced? Because I can tell you the level of education in medical school about genetics and genomics is very, very small. And even in a field like mine, where these tests are being used regularly in cancer care, very few of our oncologists really understand these in detail. So there's going to be massive information overload for healthcare providers and patients, and I think at the point of care, these are the challenges that we are going to face. So what's in store at the forum tonight? I think we're going to have some great presentations highlighting several local activities related to precision medicine and precision health. We may learn about how genomics may advance the use of pharmaceuticals from our colleague at Amgen, but I think across this, we need to be thinking about the challenges, which are really information management, the financing of this big enterprise that is not always going to be covered by research costs, the implementation of discoveries at the point of care where patients are going to be coming into a healthcare provider and asking, what should I do next? So please join us for an interesting and informative evening. And I'd be pleased to introduce our first speaker, Claire Lajonchère from the Precision Medicine, Precision Health program. Okay?